Hello, everyone, and I'm going to be sharing some insights from the study machine learning to predict patients at risk for frailty in post-op cardiac patients using ECG and accelerometer data. Frailty, as you might know, is a condition marked by reduced physiological resilience. It significantly increases the risk of complications and slower recovery time in older adult patients. The goal was to try to improve how we assess this risk. Specifically, we looked at whether data collected from wearables, such as electrocardiogram or ECG, and movement data from accelerometry data during rehab could help predict which patients are more frail than others. And of course, with better prediction, we can tailor rehab and postoperative care more effectively. To do this, we used data from 80 patients who had recently undergone cardiac surgery. This data came from PhysioNet.org, which is a well-known open source database. It included both ECG readings as well as accelerometry data. Essentially, this is basically how patients moved during rehab exercises. To assess frailty, we used the Edmonton Frail Scale and considered patients with scores of 7 or greater to be frail. We then processed the ECG and movement signals, pulling out key features such as step length, heart rate patterns, and walking speed. For any missing data, we apply standard imputation methods such as mean and mode, as well as dealt with multicollinearity to ensure the models worked smoothly. 3 machine learning models were trained to predict frailty. These included Logistic Regression, random forest, and neural networks. We compare their performance using accuracy, recall, and F1 scores. So essentially, what did we find? Frail patients tended to be older, which is not anything novel. They were only separated by a mean of about 3 years, so 75 versus 72 years, underscoring, even just slight increases of age can significantly impact our frailty. Frail patients tended to walk significantly shorter distances during the 6-minute walk test, averaging roughly about 40 meters less than non-frail patients. They also took longer to complete the test, as their working patterns showed higher gait entropy, which basically indicates more irregularity in their steps. When it came to predicting frailty, the Logistic Regression model outperformed the other models. It achieved an accuracy of 84% and an area under the curve, or an AUC, of 0.92. The most important predictors included step length asymmetry, total length on the 6-minute walk test, patient age, and maximum heart rate. Interestingly, all these had odds ratios above 4, indicating a strong association with frailty. So in conclusion, the study shows that wearable-derived ECG and accelerometry data can be powerful tools for identifying frailty in patients recovering from cardiac surgery. By integrating this kind of data into routine care, clinicians can screen patients earlier and design more personalized rehab plans that account for frailty risk. Looking ahead, some of the next steps further could be looking at how these features evolve over time, how they relate to long-term clinical outcomes. This could also pave the way for more proactive and dynamic recovery strategies in older patients. Thank you so much for watching.